We'll take a critical look at the Auditor's General report on COVID-19 now. You will see clear thievery. Sir, the way it is clear and it is evidence it's here to 2 years. Now, the Auditor General reporter, violation without approval. That is the 81 point. Section 87 of the Public Procurement Amendment Act 2016. Act 914. It provided pefe acquire your first one. Your contract. Any kwanya your first one, your percentages in Nasifo Yinano, ye disperse no. But Oba say one, this is not my focus. I say, contrary to the approval and the provisions above, we observe that the ministry, without approval of the Central Tender Review Committee, we observe that the ministry, without approval of the Central Tender Review Committee, increased the cost of 5 contracts without contracts with a total contract sum of 24,256,500. So, look at the difference. Look at the variation difference. 24 million by 4 million. So the original amount was supposed to be 20 million, but I want the 4 million extra money at the car through variation order. It is also, you see the breakdown, which tells you clearly, say a name but who, why, and the pressure, me a the panel. Why the pressure? Emi aya de pano. Se eso bi hwe ne aya de pana, eye wan e de se hwe. In the Auditor General report, as cited say, the Central Tender Review Committee increasing the cost of 5 contracts without with total contract sum of 24,256,500 by 4,017,000 through the variation order. Am I want to say no? About the saying the question is why? What happened? What happened? A very simple observation. Now, me person who knows how they will have to say. Person who knows how they will have to say. A had a member ye mo show. Say ye share ye niema, baby ye to ye sika e dia gua. Now tie. Brafom. Insurance companies are hodwa. Ye dey insure the frontline workers. Now tie. General principles of insurance requires that when an employer or an organization purchases a group life insurance policy to cover employee in case of death, accident, temporary or permanent disability, and critical illness, the employer or the organization may keep the master agreement. But the identified employee should receive certificate coverage which could be used by the beneficiary or the next of kin to apply for the claims needed when the need arises. A person can say me and ya de be ababesi adu say ekoba say bibi etumia enam say company na ye insurance policy di ama nti enya me enam be benefit but ebom ni pa be de na sima nan and a benefit. It is any partner made in a simana no enya me madwuma na mbaye ye no ana me crisis na me go through onya ho faso na ye conform mo hwe de ye pa because there are a lot of insurance companies koya gina brafo kakra. Now so this is what it is. We observed that this is the Auditor General report and Kasayo. We observed that the ministry paid 10,309,919.94 pesos as premium for special life insurance cover for 10,000 health workers. Tio, for 10,000 health workers and allied health professionals working on COVID-19 pandemic without any life insurance policy detailing the beneficiaries. Eti nyobazo child say yakwa ko chesi kade di ato and there are various insurance companies but nipa na no be benefit from the insurance policy no sa nipa kro no yehu no for over 10,000 health workers. So we were like, okay, we insure frontline workers and allied health professionals. Agreed. But those people now, you see, insure, they are nowhere to be found. They cannot be identified. Over 10,000 of them. Now, so this is the breakdown of Enyema Eko. So the beneficiaries, their location, their next of kin in case of death, nature of the benefits, and the terms of coverage, Nina were not identified. But the health ministry paid over 10 million Ghana cedis to cover 10,000 people. But whereas Nipakrona or not benefiting from the insurance, Nipakrona details to Krabona, I said, young fan say, okay, so insurance in the bar. Quite bad the modalities no and also cry insurance companies non kasa him how the insurance package is all about. The insurance company do not even know the full package of the insurance cover. And they could not give details of the beneficiaries. They could not even identify where they were. Nipa obedi na dear in case of service a woba sani pakono yetimi identify nenso the health ministry akwakotua sa 10 million Ghana cedis na dia to ono say mo farmer insurance companies no now so mo share this is the breakdown. Enterprise life insurance company ono no nya the highest why there Mudio Enterprise Life Insurance Company Limited. Why there? So now insurance companies are. You first of all consider the state-owned company first. That is the SIC. Now look at where SIC is. It is the percentage. Enterprise Life Insurance 30%. He got the highest. Meanwhile, a private business media. And at the state-owned enterprise, as I said, the state-owned insurance company, no, 20%. Enti, odika ajene dia kese. No wia or the kumano di ama omayano. Na omayano enya sika kitu ebi no mom enya dodo na. So the enterprise life insurance company enya 30% co-insured. That is the highest one of all. Eti yetia 10 million Ghana cedis to Tuwarubo. Enterprise insurance enya 30% of the 10 million. Say de Tuwarubo na ekobase obi ho kan. Nipa so hwe na ye hu no. What the common say? Nipa no kra ye ni details ye ni dibia ni nkrata de so. Nipa na ye se ne ho koba asem a. Ye hwe nipa kra na ye hu no. Now, number 3, Glyco Life Insurance Company Limited, enya 15%. Star Life Insurance Company, enya 7.5%. Holland Insurance Company, enya 5%. Ghana Union Assurance Life Company Limited, enya 5%. Life Insurance Company Limited, enya 5%. GN Life Insurance Company, enya 5%. Alliance Life Insurance Company, enya 5%. Ghana Life Insurance Company, enya 2.5%. Now, so Kesian Nankasa de Enterprise Life Insurance Company, 30% of the 10 million Ghana cedis. But the Auditor General report also actually say, how much I say? They ensured that the ministry paid 10,309,119.4 as premium for special life insurance cover for 10,000 health workers and allied health professionals working on COVID-19 pandemic without any life insurance policy, document detailing the beneficiaries, the allocation, the next of kin in case of death, and the nature and the benefit of that insurance. But yet is how the Auditor General report Abba Sadia we will 10,000 health workers. But and I remember one of the fellow Ghanaians address. On my pain and out the Danko for the catch there say, on my insure over 10,000 health workers. Probably but majority of the health workers, frontline workers, were not insured. They are not even aware of this package called insurance. This is the level of scammer. The Auditor General report, it be identified. So you see clearly say something is wrong somewhere. Now, Tobo, there is one aspect of this very, very particular reporter. It will shock you. It will break you down. Sure? The way and manner you use your the Health Minister Becca said, in the midst of the COVID, now the way pressure see what so and as if or Jilly Krana, so he wasn't thinking straight. So he would just approve, release this money, go somewhere, release this money. On him. Sure. There was a financial agreement on Ghana COVID-19 emergency response project signed between the Republic of Ghana and the International Development Association 2020. Number 6602GH requires the COVID-19 management team to put in place measures in strengthening the containment, isolation and treatment, including leasing, renting, and reversing the designated facilities and centers to contain and treat infected cases in a timely manner. How do I issue the one? How do I issue the one? Now, come here, conform. Now, get me the leasing agreement. Maybe the leasing agreement. Ya tumi aya manajia bubo kronwa ma enyama kiti bi esi yede. We are not getting those things because of the level of scammer. No, okay with him, bro. Mami, the leasing agreements. You will observe. Sir. Adia kitwe bi na kesi ye de yetimi anye. Eti amaye akasa no. Yeah. So you will understand. Sika I say a insurance and they 10,000 health workers. Yeah, you hear insurance, you hear what say insurance na you hu. Insurance companies no am sika de ato ho. Insurance companies no agi sika no e de ato ho. The enterprise insurance company enya emu 30%. And SIC State Insurance Company enya 25%. But those 10,000 health professionals and allied professionals now, we don't even know their details, who is the next of kin, and any of their vitals. But they are just got their mouth. Now, in one of the leasing agreements, In one of the leasing agreements, Tiana ye pa. Yakwaje a dime a fee. You're renting it for 25 years. Tiana, this is the whole story. You're renting a fee for 25 years. Enna Ghana Basa, you're renting a fee no. You bet you have 15 million, over 15 million Ghana cedis. You're renting for 25 years. Now, so this is it. Ministry, the Auditor General HSA, we observed that the ministry entered into a 25 years finance lease agreement with QHC Projects Limited at a total lease value of 15,265,000 in April 2020. That is your current if year for 25 years. I bet costing 15,265,000. The underlying assets were uncompleted building Iowa Adaklu. It's a uncompleted building for 25 years. I yet 15 million Ghana cedis. Edema Nipana Dane just because a uncompleted building here isolation center. Namunte womb. Adaklu, the Volta region, were managed by the QHC Project Limited. The buildings were to be used as an isolation center during the peak of the COVID-19 pandemic. We noted that the ministry could not use the facility for the intended purpose. And it's therefore for the intended purpose, and therefore remodeling the building at an additional cost of 20,382,246 with out of the 30 million that had been paid. I'm rented down 50 million. No, I'm the country 30 million added to Honomo. It's yeah remodeling na remodeling tetio. Ya said that the brofu kese bi na dia be say remodeling. Yeah renovating a dino. Na yamana ye into full complete building for an intended purpose no. E cost Ghana 20 million. 20 million Ghana cedis. Over 20 million no. Meanwhile, a dino nkasa na ye kwakwaje ye no was just 15 million Ghana cedis, which was an uncompleted building for 25 years. Near year, 20 million Ghana cedis at the Kwakwaya renovation. This is the country we have. This is the report. This is the Ghana we live in. And therefore, it is so funny, very pathetic. But the issue is that in the midst of all this, who is watching the watchman? Who is watching the watchman over all these things? In the Auditor General report at the Aba, why the BBA, why the fund is everything, recommendations, everything. Now ask yourself, from 2022, our reports in the buyer till now, Action Bay, and Omwateki, to making sure that Ghanaians will have value for its money. Now, they're interested in the sad aspect. The interest in the sad aspect of it is that ya check COVID-19 levy so say will be entry 1%. Sikadi the 50 million akwa rent uncompleted building. 25 years. Ye renovation, ye remodel a dino, and no cost ye more than 20 million. Ye fine ye juma, ye jadano, ye see one of Nadana bosom. It is said last year, ye call na not that go for the more quiet of Gobuza, yeah. Kwajima men call on Gobuza, yeah. It is a dina Kawurama, ye woon ye fa a dino. But we have already paid 30 million out of the 50 million Ghana cedis. And they did 20 million and they are remodeling. Remodeling and say renovation. Because it wasn't in the best of its shape. Therefore, it is now control the answer whom say COVID-19 levy 1% that's why. Now no sikano mudi no. Eno na wutua no. Sisi akwa koton suo just sachet water cry now. You're going to pay that COVID-19 levy. You better was me at the watch now. You better was me at the watch now. So who maybe that say say Ghana ni start say or come say COVID-19 levy and person betua and now taxes are hold one door so now man your nene catch now say there be chichire so utia you should know say sikano we dey wie na kadanya enye completed enye completed and kwa rente and as be complete and now this sika more than a dan now the kwa shame uwie ya o say dan so kra da ne isa me dey ye no me fine ye kra me jada na so ba na sa pro ne yete ha ne ye hwe obi ne yete ha obi da so di minister ne yete ha obi da so edi the position edi di me eti COVID-19 levy de mo fa hye mutrim ye be koso atua because eskado munya ntete ka nwie omunya nwie o omutete ka nwie ye de be koso atua bear in mind and have it at the back of your mind say COVID-19 levy no ye nya atua na enya atua okira because yedi sikada wie COVID is so a ye hwehwe Ghana ha ba bia ne say COVID na wo hefa ye hu COVID no Ghana ni minim ba bia wo COVID na where COVID ni be isolation centers na ye ka no what will be what is the use of the isolation center now sikana yedi ejuma na yamfanye but Ghana ni e dey twa so sometimes when we tell you the ordinary Ghanaians say enema mi wo hodom you should be guided but be mindful obey what Jesus sabio Ghana ni mpewasem and answer say joining mpewasem because of your political affiliation. No way, it is not just about your political affiliation, it is about the management of the economy and making Ghana a better place to live. Abana jwe so ya ne say abana metiska chef fa che mi jebi botom abana on fasika ma me she Mr. Chubotom abana on fasika e fa ma me she na kwa mi botom but abana should create an enabling environment for businesses to grow say the be ya abana betimi anya ne to e de afri so but adia Ghana ni enya ho faso no ade tire say Ghana ni tua ho ka na ade ne kura na ye hwehwa ye hu Tiyo Ghana sikano COVID-19 sikano ni yede kokko rente ye no ya rente ye tua ka 30 million awie ye de 20 million akwa ye renovation and a remodeling or whatever they call it ye wie ya oh funny enough project Nankasa Krana has not been put into use but Ghana ni ya chairman say tia na wutua wi yeso ye de akwakoye den akutua ye bosia na ye de no. This is the Ghana we have. Ladies and gentlemen, I'm here to watch now. Now it is so funny and it's so terrible. Say ya ngine Ghana honi ya for Ghana say ye baby ya. This is the kind of result ye benya. Say ya ngine ya Ghana ne ho na ya ma Ghana ni na hu say that we have a certain Ghana ye benya ho faso dachi bia. Say ya na beba na eba wie ne agi ye ni so a na afia start say ye bobo ye hwene na refi say wo manyosem now ye has no relevance and has no significance to whatever you are doing.